Happy Wednesday Wellness, everybody!
Woohoo! Woohoo! It's
We're
Wednesday.
back.
You get to
Look,
see our faces.
New year, we're doing all the videos. So, today we're talking about dysautonomia, and specifically...
What is dysautonomia?
So, dysautonomia is...
It's a long word.
It is. It's when your autonomic nervous system, so that's all the automatic stuff that happens in your body.
Breathing, heart rate, digesting food,
Yes.
things we don't think about.
Exactly.
Autonomic.
Yep, so that's
Autonomic.
autonomia.
Automatic.
And dys means it's not regulating the well
Difficult.
as well as it's supposed to be. So we've been posting a lot about POTS because it's something that's come up a lot recently. And so that POTS,
What is POTS?
POTS is Postural Orthostatic Tachycardia syndrome. So what that means is when you're changing postural, so like when you're coming from laying down to sitting up or sitting up to standing, it's that like kind of faint feeling, heart racing.
Yeah, I feel like lightheaded.
Yes, you can even have like blackouts or faint if it's like really bad and stuff. We see this in a lot of moms. We see this in a lot of like teens, especially teens with like anxiety and stuff like that too, because it all goes together. It's all part of that like sympathetic dominant nervous system, which we talked about, parasympathetic and sympathetic dominance.
Sympathetic, yeah. And it's like, okay, so why are we getting this? Like, why is it dysregulated in the first place? Usually due to some sort of stress.
Yes,
right?
yeah, exactly. So when our body goes through either like, big emotional stressors, big traumas, so this can be anything from like, this can be like a fall or something like that. We see kids like show up with, tics and stuff after big falls off of their bicycles.
That happened to my stepdaughter.
We could see, this can be stuff from birth, that like stress that's never kind of
we've always talked
on either
about
mom or baby.
Yeah, like maybe it was a baby that was, colicky, constipated, didn't sleep well, right? And they're like, yeah, they grow out of it, and then change something else. And now, like as a teenager, these are the issues that are showing up that never got cleared out of their nervous system, right?
We have some kind of emotional stressor that then sends us into like kind of triggers this like fight or flight, stuck in this sympathetic dominant state,
and they can't get out of it.
Exactly. And so then how our body responds to that is it affects vagus nerve, which is it's like our main parasympathetic pathway in our body. So it's what controls our heart rate, what controls our breath rate, our focus, our immune system, our ability to digest our food, like all of that stuff. So kids that have trouble like focusing or even emotional regulation, that kind of stuff, it's all tied to vagus nerve. So if vagus nerve's not working well, then we'll start seeing all of these symptoms come up. So not just specifically POTS, but also like the anxiety, the sensory stuff,
the ADHD,
tics.
tics.
It's all kind of tied together in that dysautonomia, dysregulation, stuck sympathetic.
And maybe you've tried a lot of things, therapy, behavioral therapy, OT, I'm just trying to think what else they would do. Medication, all different things you can try for your kid, and maybe it's gotten better some, but hasn't really actually gotten to the root cause. And so when you add in chiropractic care, it's usually just a little oomph you need to get over the hill to really help.
Because chiropractic care helps re-regulate your nervous system. So if your nervous system's still stuck in fight or flight, anything else that we're putting on top of that, any medication, any therapies that we're putting on top of that, is just kind of like coating over this root that's not working or not functioning properly. So it's just even can be more stressful to the body and more stressful to the nervous system then. But if we get to that root cause, if we're looking at like, okay, here's the nervous system dysautonomia, we need to like help reset this nervous system, help that heal first, then the foundation is there where all of those other things can be more effective. But you may not even need some of those other things too, because your nervous system is regulating the way it's supposed to then at that point. So
if like you, or maybe you're a teenage kid, or you're a preteen, or whoever's dealing with any of this stuff, like, yes, POTS is what most, like, we're talking about this week, but like you said, any of those other sensory things, dysregulation things, you should get in and get an exam, sit down, we'll talk about the history, like what has your kid dealt with so far, and is this a good fit for them? That's something they maybe need to try. Maybe you've tried chiropractic before and it didn't work. Well, we usually look at things a little differently.
We do, and we like the way that we care plan and stuff is all different. The way we scan is different, so we can scan and see dysautonomia in your body.
Like, where is the stress in your body?
Yes, exactly. Whereas, like, if you're just taking x-rays, you're not going to see those things. You're not going to see things as deep on that nervous system level. So that's one of the reasons why we practice differently, because there's a lot of things that you can't just, like, physically see with your eyes. You need to be able to, like, look deeper, look into the nervous system, see how stressed out that nervous system is in order to plan appropriately.
Yeah, and I feel like, at least with my own kids, just other parents I've talked to, like really the return to school after Christmas break, the holidays, winter, kids are like really like amped up right now.
Yes. Yeah.
We're seeing it more. Like,
Yeah. So that's stress, and also going through like an illness too. Like that's
oh,
another.
I was
stressor
going to
that
say we
could-
should do a talk on this, but if
Yeah.
you want to talk about it now, we can. Like
We can
being,
go deeper.
Yeah,
next
being
video,
sick.
yeah.
This happened to my own kids. They got sick, just had a fever. It wasn't a huge sickness, and then have been so emotionally dysregulated. Like so much stress to their system. I think on top of the holidays, on top of returning to school, it just like really put them into a fight or flight, where I've had to adjust them like multiple days in a week, and they've been under care since birth, so it's like even they, you know, there's a time. So like, hey, yeah, has your kid been sick? And I just had a parent in, like, hey, can you fit my kid in today? They weren't on the schedule, they're sick, and their emotions like woo, and I was like, oh yeah, that has happened to my kiddo.
And
like,
that may mean we need to like again ramp up that care to help regulate the nervous system again, even if you've been under care.
yeah.
I mean,
but that's
have
something
it
we
with
can
us,
like
too.
help with when you're like, oh my gosh, what is going on? Like, okay, well, you shouldn't have to suffer through it. I don't think that kid even knows what's going on. They don't need to suffer through it either. They don't know how to regulate their nervous system.
Exactly.
So.
Yeah.
But we can help.
Yep. All right.
So yeah, contact, call, do all the things.
Yep.
Find us. We'll get your kiddos in. We'll get you in.
And if you watch this video, we'll offer you half off your initial exam too. Reach out with any questions. I mean, if you want to book an in-office consult online,
we do this
that's
at no
easy.
charge.
Yep, no charge. You can ask us all the questions and come meet us in person. And
Yeah. Are we a good fit?
Yeah.
I'll let you know. All right. Have a great Wednesday.
Happy Wednesday.